Thank you, Madam Chair. It's an honor to be here, and I have just 7 minutes, and I have a lot to tell you. So, does antiretrovirals cause hypertension or not? That's the first. Okay. So, here we can see my opponent, and it was very difficult to find a Disney girly, so I decided to change it, and you can see my opponent. And here you can see a Chilean warrior, a Mapuche. That's our native originals from Chile. So I picked myself like that. So let's go first to what the outlet says. And there's a lot of information regarding HIV drugs can produce hypertension or not. So let's go to more scientific. And we need to search not only in HIV or infectious disease journals, we need to look also in journals like current hypertension reports. There are several journals that we usually don't read, the ones who works with HIV and AIDS and infectious disease. So the information is probably published in other parts. So in this review, we can see the first mechanism of why people who live with HIV and are not taking antiretrovirals are having hypertension or not. So they propose some evidence about the pathophysiology. Hypertension is influenced by several chronic immune diseases, and we know, for example, overweight or obesity or dyslipidemia. All that kind of things can cause inflammatory environment that can end up in hypertension. This review are 45 studies from 13 unique African countries, and that's why I call this debate. I don't know if it was shown in the slide because I don't see very well. I'm too short for this. That I call this debate like the global north against the global south, mostly, because most of the evidence comes from the global south. And sometimes we that belong from the global south don't feel like very well listened when we publish things because we don't belong to the mainstream. So these studies, 45 studies from 13 unique African countries, and the prevalence of hypertension go very broadly from 6 to 50% or 2 to 41%, depending if you take in antiretrovirals or not. And the pathophysiology says that not only the HIV proteins, but all of the HIV drugs can produce some damage in the vascular walls of the blood vessels, so that ended up having more hypertension. So there is explanation. We know why this is happening and why antiretrovirals having a role here. This is another study, this is another review, evidence in increased blood pressure and hypertension risk among people who live with HIV, that's the correct term, remember, you all know that, on antiretrovirals. And it's, again, a systematic review, and this is very interesting. You can see the huge number of participants, and in this, it's very easy to see, not sure if I have a pointer, no, I don't, but you can see the systolic blood pressure and the diastolic blood pressure, and in both of them, there is a significant difference between people that are using or people that are not using antiretrovirals, and it goes obviously that there is more high blood pressure, systolic and diastolic, in users of antiretrovirals. And then if you go to this forest plot about the risk of having hypertension, you can see again in red, that red diamond on the bottom, that the risk is higher if you're using antiretrovirals. There were no evidence of differential effects of antiretrovirals according to the study design, the country income, the age, the sex, if you're a smoker or not a smoker, what kind of antiretroviral treatment you're using or not, and I'm going to make a comment on that. How long have you been using antiretrovirals, the sample size of the sample bias. But at the end, the evidence show that reviewing this more than 40 and a lot of patients, there is more risk for hypertension. So exposure to antiretroviral is significantly associated with increase in diastolic and systolic blood hypertension, and increased risk of hypertension in general, independent of the socio-demographic difference, because we're always blaming this demographic difference. This is another study, and here we go again with the Global South from South Africa, a prospective cohort study from adults, black adults from African ancestry, matched one-on-one, the ones who remain in efference, and the ones who change from dolutegravir, as you know, are the WHO recommended first regimen. So they match and they balance against sex, again, month of antiretroviral, kind of antiretroviral of first line regimens, and what happened at the end, in the real-world population, patients gain more weight, and we know that elevated weight goes together with hypertension. And I have only 1 minute left, and this is another study from Ghana, the prevalence of hypertension among people living with HIV on antiretrovirals, and it says again the prevalence is 17.5. If you are older than 50, your risk is higher. If you're overweight or obese, your risk is higher. And hypertension, it's a very common condition among people living with an HIV. And again, here in Ethiopia, it's the same results. This is a smaller cohort that is always showing more or less the same, but I want to pay you attention that all these studies are coming from Africa. And I cut this red cross here because we know that's not the correct way to say it, but prevalence of hypertension and association factors in Burundi. And what is important in this publication is that most of the people living with hypertension and living with HIV, they are not aware, and their physicians are not aware about hypertension. And we need to treat that hypertension too, obviously, so we need to do the screening for that. So that is my evidence. There's a very heavy weight of evidence, and that's my final Marichueo, that's a Mapuche Chilean woman. 10 times we will overcome. That's a fight anthem. Thank you.